10 o'clock, so I think we can get started. I would, of course, like to begin today by acknowledging the traditional custodians of the land that we are on. At the Knowledge Centre here are the Whadjuk Noongar people, and pay our respects to elders past and present. My name is Avina Trzynski. I'm a research officer at the Health Infonet, and joining me today, if you'd like to pop into the camera, is Millie. She's assisting us with any technical issues. So if you have any issues, please type in the chat box and we will try and help you. We both work at the Health Infonet and we work on the Australian Indigenous Alcohol and Other Drugs Knowledge Centre project. So thank you for joining today's webinar. We're very pleased to introduce our guest presenter, Associate Professor Scott Wilson. He's the CEO of the Aboriginal Drug and Alcohol Council in South Australia. He has many roles, including Adjunct Associate Professor at the University of Sydney and the Co-Deputy Director of the Indigenous Health and Substance Use and Addiction Medicine at the University of Sydney. He served as Deputy Chair of the National Indigenous Drug and Alcohol Committee and Chair of the Foundation for Alcohol Research and Education. Scott is also one of our reference group members for the Knowledge Centre project. Scott's worked in Indigenous communities and with Indigenous communities nationally to develop innovative ways to prevent, treat and reduce harms from alcohol and other drug use. He has received several awards, including the Australasian Professional Society on Alcohol and Drugs First Peoples Award, an Alcohol and Other Drugs Council Australia Australia Day Award, and the Australian Centenary Medal. Scott is an investigator on 3 NHMRC funded projects and grants. So the theme for today's webinar is Creating Pathways for Indigenous Australians. Aboriginal and Torres Strait Islander communities do report alcohol is a high priority issue. However, there's a national shortage of Indigenous Australian researchers with expertise in the prevention and treatment of alcohol problems. This means that it is harder to have research that is appropriately designed, delivered and interpreted. So Scott will talk about the Centre for Research Excellence in Indigenous Health and Alcohol that is aimed at supporting Indigenous researcher capacity in the field of alcohol use and health. So we'll have about 10 to 15 minutes at the end of the webinar for questions, so we'd like you to save them for the end of the presentation. We're going to now switch over to Scott in Adelaide and he can take it away. Thank you, Scott.
No worries, thanks a lot for that, Avina, and welcome to all the participants that are sort of logged on to hear about some of the things that we're trying to do, obviously in creating pathways for Indigenous Australians to try and lead the way in alcohol research. Obviously, this is, as Avina said, is an exciting area as far as I'm concerned, and obviously the people that we're associated with in terms of the Centre for Research Excellence, such as Professor Kate Conograve, Kylie Lee, and a range of other people that I'll go through in a minute. As Avina said, like there is a lack of research. We hear about it all the time in terms of, alcohol and alcohol-related issues, whether it's in Central Australia or right around the country in actual fact. And I suppose over the years, governments in trying to deal with issues have brought in legislation where, they declare things dry zones and things like that with little or no evaluation of the effectiveness of that. And so anyway, one of the things that we're trying to do with the centre is actually give Aboriginal people that sort of voice. And like I said, I'll talk a little bit about that in shortly. But to get on with it, we'd like to acknowledge, obviously, I'm in Adelaide, so I'd like to acknowledge the Kaurna people for allowing us to be here today and to sort of talk on their behalf, and also their elders past and present. As some of you might know, alcohol is a big issue. It's a leading factor for disease and disability in ages basically 15 to 49 globally. It's also, if you have a look at the burden of disease for Aboriginal folk, it's quite high when you throw in alcohol, illicit drugs and tobacco. It is the major burden of disease. Aboriginal Australians are 3 to 8 times more likely to be hospitalised for an alcohol-related issue versus other Australians. And there is a severe shortage of Aboriginal and Torres Strait Islander researchers in the alcohol field. Like, shortage means that there's not that many, if any at all, that are actively involved in, alcohol and drug research nationally. It is a big issue. It's a priority for Indigenous Australians, as Avina said, and regardless, I've been involved in national drug strategy type committees and things like that since 1998, and it's always been up there as a priority. And you'd think that by now we would have come away to deal with that. Unfortunately, as the Close Gap report recently just showed, clearly we're not achieving those sort of goals in a whole range of areas, and we haven't been doing that really since Close the Gap started. It does take a heavy toll on families and communities. Some of you might work with Aboriginal folk or communities, and as you probably know, it's not just the impacts on the drinker, but also immediate and extended family and the whole community. And so addressing alcohol is the key to improving health for Aboriginal people and Torres Strait Islanders as well. And so basically, one of the ways that some of us are trying to do that is through what's been funded through a 5-year funding from the National Health and Medical Research Council, is the Centre for Research Excellence in Indigenous Health and Alcohol. It was officially launched last year. And we aim to recruit and support Aboriginal and Torres Strait Islander researchers in that area. So basically, the centre itself is quite innovative. It's the only one of its kind, as far as I'm aware of, that's sort of dealing with Indigenous folk anywhere in the world. And so, some of the things that we try and get involved in is through that centre is having research people, involvement. There's mentoring, network, and on-the-job training. For example, part of the issue is that once we get students, whether they're doing a master's by research or a PhD, because that's the goal, is to try and get upwards of 15 Aboriginal and Torres Strait Islander folk through to a master's or a PhD. And to do that, obviously, as some of you might know, if you're coming from a university sort of sector or whatever, it's not easy. But one of the things that the centre is trying to do is to make it a little bit easier for Aboriginal folk to sort of get to those awards, because like I said, I've been around for a long time, and I don't know of any. I think there might be one person in Australia that's actually got a PhD in alcohol-related areas. So, and that's just one Aboriginal folk, and it's obviously not enough. So, part of the things that we do through that centre is obviously there's annual training forums. We support people in going through to conference participation. There's a Cert 3, Cert 4 undergraduate, and then there's the Masters and the PhD, where we actually do have funding where we will offer scholarships to people who are interested in coming over to us to sort of do their research. There's also a transitional fund, early career researchers. Some of the chief investigators that are involved in the Centre for Research Excellence include Professor Kate Conograve from Sydney University, and also Prince Alfred Hospital, Professor Anthony Shankshaf, who's from UNU, Professor Noel Heyman, or Dr. Noel Heyman, who runs the Inala Indigenous Centre for Excellence, Inala Health Service, Haber, Dr. Kylie Lee, Associate Professor Rowena Ivers, Professor Chris Doran, and Dr. Anton Clifford. So as you can see, some of our associate investigators include Jimmy Perry from ADAC, who's been involved in the Making Tracks program for over 15 years now. Steve Ella, who some of you might remember back when he used to play football. Professor Dennis Gray, Michael Doyle, Annalene Stern, Associate Professor Angela Dawson, and Associate Professor Tim Dobbins. One of the things that we were quite well aware of is that we needed to have an Indigenous advisory group attached to this centre, and obviously to drive not just perhaps what the areas of research that we might be looking at, but also to sort of look at the students and sort of provide advice back to the chief investigators on that. I'm the chair of that committee, and some of the other representatives, we tried to be a bit national, include both Warren and Jimmy, Nathan Deves, who's from New South Wales, Sonia Eggart from Queensland, Annalene Stern, who's the Northern Territory WA representative, Lee Jockerman from Victoria, Christy Harrison, who's an early PhD student, and also Michael Doyle, who's in his final year student as well. And we meet quarterly. Some of our students that are already engaged in the centre are Christy, and I'll talk a little bit more about some of the research that they're actually doing. Doug James, Benita Byrne, Tegan Wetherill, and also Summer Loggins. Anne-Marie Eads, who just graduated, I'm pretty sure just recently with her PhD, and Michael, who's just submitted his thesis, from what I gather, who'll be awarded that sometime this year as well. So congratulations. Clearly, none of these centres for research excellence come about unless you have partners, and we're happy to sort of, obviously, we did get a grant from NHMRC for this for the next 5 years. Some of our partners include the University of Sydney, National Drug and Alcohol Research Centre at UNSW, New South Wales Health, Central University Queensland, the University of Queensland, Aboriginal Health Council here in South Australia, Griffith University, the Centre for Alcohol Policy and Research at La Trobe, University of Western Australia, the National Drug Research Institute, and also the University of Technology Sydney, as well as AODAC as well. So what do? We basically, some of you might have seen some of the ads just recently where we're actually advertising for students to sort of who are interested in doing their PhD or their masters. There is an open round at the moment, so if you know anybody who might be interested, get them to come to the website, which I'll tell you about a little bit later. Some of the things that we do with the students is we have monthly student traineeship and early career meetings. We have one-on-one phone conversations, web conferences, or we try and meet as often as we can in person. We do provide annual support for students who are doing those sort of degrees to conferences or also training that they sort of, obviously it has to be of relevance to what we're on about. We provide support for their direct research costs, and every year we have a 2-day workshop symposium where we will get those students to sort of, I suppose, present in a symposium type environment what their research is about, what some of their findings are, and also to find out how they're going, are they having any problems, and how can we actually help them get through those sort of issues. As I said, there's an annual public symposium, and we're lucky, I suppose this year, being 2018, AODAC is hosting the National Indigenous Drug and Alcohol Conference here at the Adelaide Convention Centre in November, and that's where the symposium for all of those students will be this year. So basically it's looking at some of the planned outcomes. Like I said, we look at try to present in the area of policy, try and have a bit of input and all of that. There's also the practice areas, try and shape guidelines, standards, training. The research is to get people invited to present on what their research might be, hopefully a keynote. And we're happy to sort of announce that Michael Doyle, who's one of the who have his PhD this year, is one of the keynote speakers at the NIDAC conference later this year. Clearly, citations, if we can get them, as you know, they're supposed to be involved in writing refereed journals, and we're happy to sort of help people with that. And some ideas or methods that we could take up in the work of others, and basically go back and present or advise consumer or community groups on some of the outcomes of their research. But anyway, one of the things that obviously excites me, I actually think it is a game changer in terms of how people self-record, alcohol consumption, considering that we tend to rely on the National Drug Strategy household surveys to give government and policymakers, I suppose, a bit of a snapshot of how drug and alcohol might be affecting, or how people are consuming across the country. But we do that every couple of years. And you've probably all heard the same scenario where people talk about most Aboriginal people don't drink, but those that do drink at levels that are harmful to their health. That comes from basically the 1994, I think, or 1996 household survey, because they had an actual Indigenous supplement in that one. They haven't done one since. And so basically a lot of our knowledge in terms of how Aboriginal folk consume alcohol is based on that survey, and also the subsequent household surveys that have been held since. And we already know, for example, that some of those surveys underestimate people's consumption and fact, things like that, in particular for women, by about 700%. So anyway, myself and some of the people that are involved with the Centre for Research Excellence, such as Dr. Kylie Lee and Kate Conograve at the NIDAC conference in 2012, were talking about this sort of problem, and the fact that most Aboriginal folk these days do have some form of smartphone technology. And so that's where the idea really came about trying to actually put that sort of information into an iPad or a smartphone, and actually start using it in terms of self-report data. And we basically, because when you go and ask somebody, oh look, how many drinks do you have, or how much do you drink, or how many standard drinks do you consume, most people don't really know what you're talking about. And when we look at the containers, not everyone's got sitting there having a nice 30ml nip in a nice wine glass or a spirit container or whatever. The people that we tend to deal with could be drinking in a whole variety of different containers, such as 2-litre bottles, Mount Franklin, or those sort of water bottles, which are 600 mils, or in a pannikin. And as you can see, for example, a cask of wine could hold up to 40 standard drinks, down to a pannikin, which might have 4 standard drinks. So when you actually ask people how much they drink, they might actually say, oh, look, I only have 2. But when you actually if you take the time to sort of say, okay, well, what are you actually drinking from? You might find that those 2 drinks came out of a 600 ml container. So that's part of how the whole idea of the grog app, as we're calling it, came about. Some of the other challenges were, cultural differences, what was the usual pattern of drinking, language literacy barriers, and also some of the shame or sensitivity about being asked about drinking. So, for example, John, how much do you have when you're drinking? He might sort of say 3 drinks of wine. You should be saying, well, what do you drink out of? And for example, he might turn around and show you, well, he's drinking out of one of these sports containers. Same as like with Meg, these are made up names. How often do you drink? She might say, I don't drink. Okay, do you have anything for grand finals, because what we tried to do with the grog app is embed in there sort of events in people might actually remember, such as, you know, the AFL, the NRL grand final, New Year's Eve, NAIDOC week, things like that. She said, and how many days would be enough to get tipsy? Is that closer to a six-pack or 2 cases of beer, for example? And she had a case of beer, which is a carton. So initially you asked the question about how much do you drink, and she said she didn't drink at all. But then once you actually got more into it, you found out that there were occasions that she did actually drink it. So does she drink on her own, or is it shared? Because that's important as well. And she's answered that she shared with her and her partner. So what we did is we had a consultation. We had experts from the country to a workshop in Sydney, and we went through a process about how do we go about developing this as a tool that people might actually use. We then engaged the company in Sydney called Nest, and basically went about with them to develop it as an iPad app. We've then chose 3 communities where we tested that. Then we looked at refining it, and then we're basically going to test it in another 2 communities. This just gives you a bit of a look at what the iPad does look like. For example, when you first come on there, it'll ask you whether you're a male or a female, and in this case, the person saw, and also, do you speak a language other than English? Because we do have the whole app translated in the Pitjantjatjara. And for example, this woman's chosen that she speaks English and she's a female. So from then on, basically all of the iPad pictorials, I suppose, will depict female type images, whereas if she had picked a male, if she had been a male and picked a male, it would have all been male related. It asked her when she drank in the last 12 months. She's indicated that it was, she drank since the grand final. We asked where was the last place that they had any grog, and where were you drinking? This person, they have a whole scenario: the park, the beach, the pub, home, wherever. Any alcohol container or most alcohol, because as you're probably aware, depending on what state or territory you might live in, depends on what sort of might be the alcohol, popular alcohol that, in particular Aboriginal and Torres Strait Islander folk might drink. So we obviously went back to our reference group to sort of make sure that all the different alcohol beverages that people were drinking were included, so that they can scroll through here, for example, and pick, the different types of alcohol that they were drinking. We also ask, questions like, what sort of container? And as you scroll through, there'll be basically every conceivable container that people have told us that, the client group might actually be consuming alcohol out of, because, not everyone's sitting in a pub, drinking out of a schooner or whatever. Some folk, unfortunately, are drinking out of a whole range of things. We didn't even have to ask them questions about, well, how many standard drinks, because basically if they pick the container, in this case it's a water bottle, and then they can scroll up and down on the iPad to sort of indicate when they do have a drink, how full or whatever that container might be. And in the back end of the app, the software will calculate how many standard drinks were in that. We also ask them, well, how many of those containers might you drink in a given day? And again, they can scroll along until they get the right amount. And like I said, a lot of people do drink in groups. In particular, people who might be drinking in park situations, or in some of the areas where we go, for example, and I've been around the country, it's no different. People will tend to be drinking in groups. So basically, we do ask them about, how much the whole group might have drunk. For example, how many people were you drinking? In this case, there was four blokes, or five, and so they tell us that. And then how much did the group drink? Again, you just scroll along the bottom of that. And like it says, when people drink together, they have the same amount. Other times they drink more than others. So what was your share on that particular day? We believe that, or some of us think anyway, that electronic age, self-reporting alcohol consumption, and you could probably take it into other things such as tobacco and things like that. People are a little bit more honest, because this is all done confidentially, by the way. It's not as if I'm sitting there with a notepad and asking people about this. We basically gave people in these locations the iPad and a set of headphones, and basically, just had to tell them a few instructions. They had no problem, and whether English was a second language for them or not. And in some cases, for some of these folk, it was the first time that they'd actually seen or used an iPad, and they had no problem using it whatsoever. So it is confidential. They can actually record their own answers, rather than having someone like me recording it for them, for example. We think that it's a lot easier using the app to tailor drinking guidelines to each person's drinking. And we're comparing that with also clinical interviews that were taken at the same time. It also gets people to think about their drinking. And there's also a better understanding of drinking patterns and contexts, which obviously can inform policy development and monitor if the policy that the government or even community might have put in place to, for example, around alcohol restrictions, is it working or isn't it? So the app is really exciting, and if people, like I said, we've already trialled it in an urban, a rural and a remote community in a number of different states. I went to a workshop recently where we were looking at some of the data, and my understanding is that depending on whether the abstract's accepted at the NIDAC conference, but some of that data will probably be discussed at the NIDAC conference, and it is exciting sort of stuff. One of the other things that we have a NHMRC guideline grant with also is because we have to start where a lot of people do go, and let's be honest, in particular, some of us tend to deal with people who might be at the end stage or fully entrenched in their alcohol consumption pattern. Whereas one of the things that we're trying to do with supporting primary care services is to actually try and start that intervention a lot earlier. For example, when people come into a clinic. And the people that are involved in that research, besides Professor Kate Conograve, is Christy Harrison, Tegan, Anne Marie, and Summer Loggins. We're trying to support Aboriginal community-controlled health services to do their best for unhealthy drinking and allow services to inform the research process, making sure that there's cultural care and also that we're using current evidence. So far, some of the things that we obviously were quite clear about is that the services that get involved in this research had to be using Communicare or Communicare. because obviously we needed to be able to sort of, make sure that all of the services were using the same database, that they had 600 plus clients in a given year, and that they were over 15 years of age. So far, in phase one, or in this phase, we've recruited 22 Aboriginal community-controlled health services across Australia. And what we've done is we split those into two groups. 11 services, for example, will get the support and the training that we're offering, and the other 11 will basically don't get anything at that stage. So basically, it's about they choose two representatives, a clinician and a manager. A research assistant will support those representatives and the services to identify barriers to best practice, for example. And this may mean changes to practice software, staff training, and developing and sharing resources. Basically, they'll join forces and share their ideas and experiences in service improvement through a range of monthly teleconferences, and each intervention service will get regular feedback on data from their software and how they're going, how often they screen for unhealthy alcohol use, and how often they provide advice or treatment. Because as we all know, brief intervention does work, and the earlier that you can sort of maybe talk to clients about whether it's alcohol or other substances, those interventions can have a bigger impact down the track. We'll compare the results for the intervention, how often screening is done in treatment provided, for example, blood pressure, service-wide levels of drinking, liver blood tests, and then basically what we'll try and do is halfway through the study is that the 11 that didn't get any of that sort of support, training, and all of that sort of stuff, will then provide that to that 11 as well. And basically, like I said, we'll be able to compare to see whether anything or if the whole package that we did improve care, and also, some of the benefits are greater staff skills and confidence. Because, look, I go to a doctor, and like all of yous, I doubt whether my doctor's actually asked me, God, in a long time, whether I drink, and if I did drink, how much do I drink? So, it's things like that. Some of the other benefits are improved systems, more community awareness on safe drinking levels and treatment, and obviously ongoing quality improvement. Looking at some of the research, or some of what the students involved in the Centre for Research Excellence are doing, for example, Doug James, who's a Wiradjuri man from New South Wales, his research is basically in partnership with 6 Aboriginal residential rehab services in New South Wales. And basically the whole reason for his research came about is because there's little evidence on really what constitutes success for Aboriginal folk, for example, coming or outcomes from a residential rehab service in Australia. And so basically that's what Doug's research is involved a bit in. Obviously, someone like myself is really interested in that, because AODAC does, in a consortium, run a residential rehab, and we constantly hear, people sort of say, well, look, rehab's a bit of an old hat and a bit of a waste of time, and people might come in and relapse, and so therefore, what was the whole point? But at the end of the day, rehabs and therapeutic communities obviously do have a place, whether you're there for a week, 12 weeks, or the year. And so we look forward, obviously, to the outcomes for Doug's Doug's research, and basically, obviously, looking at what might actually constitute success or otherwise. Some of the other is community efforts to prevent injury, and that's been with Bonita Byrne. She's looking at prevention of alcohol-related harms in young people, and also trying to empower Aboriginal communities to address alcohol problems in a multi-pronged community-led way. She's obviously undertaken that research as we speak. Michael Doyle, who's a Bardi man from WA, is, like I said, has submitted his thesis, and I'm pretty sure that he's got all those comments back and will be probably awarded a PhD sometime this year. He's looking at, his is all about prison, and we hear a lot in the media and all of that about, Aboriginal folk and prison. But what I find interesting is that there wasn't really a lot of research happening around the whole issue of Aboriginal folk, alcohol dependence, and also incarceration. For example, Michael's research looked at over half of the New South Wales inmates drink enough to warrant a clinical intervention, and that was whether they were Aboriginal or non-Aboriginal. And for example, in Queensland, nearly half of Indigenous inmates had histories suggestive of alcohol dependence. He established a pilot model of care to try and reduce relapse to drinking on release, because as we might know, unfortunately for a lot of folk, when they do get released from jail, obviously it is I suppose a danger time for them in the first probably month after release, really. And if you go and talk to any Department of Corrections, for example, a lot of people unfortunately do die upon release from prisons, whether it's by overdose death or other reasons. Basically, he did qualitative interviews with inmates, justice health staff, family members, and also looked at the quantitative data from Connections and New South Wales Health. So basically, it's an opportunity to build on the skills of this whole Centre for Research Excellence. Like I said, we've got a range of different research projects that are involved in the centre now. We have quite a few students who are either just finishing their PhD or are starting a master's, or hopefully with our ad round that we've got, that they actually might be looking at those sort of areas. So if you know anyone that's interested, get them to contact either myself or Professor Kate Conograve. It's an opportunity to build on the skills of Indigenous Australians in a supportive and enduring network. The project aims to give short and long-term benefits to communities. It also gives Aboriginal leadership and research, offers potential for sustained and meaningful improvements. And like I said, scholarships for Aboriginal and Torres Strait Islander Australians are available, are now open. I can't stress enough that if you know anybody that's interested, basically they just have to come and talk to us about what their research area might be in, and allow us to sort of either guide them. They don't have to necessarily be a student, for example, at one of the partner institutions such as Sydney, UNSW, Central Queensland, and some of the others. They can be at different universities as well. So basically, this is how you can download the centre, for example. You can download that onto your phone if you wanted to keep up to date as to what we might be doing down the track, because I do know that, for example, with the grog app later this year, or hopefully later this year, we'll be looking at stage 2 of that, what sort of other things can we add into the app, for example, and that obviously involves doing an HMRC submission, and hopefully if we're successful in that, then we'll be able to add other things into the app. We know that the app already we have people from different organisations wanting to sort of be able to use the app, and myself and Kylie, for example, at the Global Alcohol Policy Conference last year in Melbourne, we did have a bit of interest, for example, from places like Thailand, the US, and South Africa around the app. So we think that it does have not just applicability here in Australia, but also internationally. So that's exciting for an Aboriginal organisation such as AODAC, who's associated with Sydney University and a range of others, to actually help develop something that, like I said, can help communities Australia-wide, but also other Indigenous and non-Indigenous people across the country. So if you want to find out more about the centre and what we might be doing, or how do you go about getting people to apply for a PhD or a Master's MPhil scholarship, they can go to www.gathering.edu.au, or they can contact me, scott@adac.org.au, and also the Australian Indigenous Alcohol and Other Drugs Knowledge Centres information, phone number, Avina's email, and also the email for the knowledge centres there. So like I said, I hope I've provided you with information about the centre. I hope it was interesting. I hope that you'll agree with me that in particular for the Aboriginal folk that are enrolled or engaged in either an MPhil or a PhD, it is life-changing sort of stuff for them, and also not only just for them, but also their family and their communities, because basically it takes one person to be able to succeed in going through to a university or a PhD before other Aboriginal folk will think, well, if Michael can do it, then maybe I can do it as well. And hopefully down the track we'll have a whole range of these people that we can sort of rely on that might be actually able to provide an Aboriginal solution to some of the Aboriginal problems around alcohol and other substances. Thank you.
Thanks, Scott. That was fantastic. And well, we've got about 10 or 15 minutes for questions. So if anybody would like to ask a question of Scott now, please pop it in the chat box and we can go from there. So you're getting a few thanks, Scott, from Mika and Gabrielle. So it looks like a few people might be starting to type some questions in.
I know it's stunning stuff, so like, it could take a while, but
no doubt. I think you just did too much of a good job, Scott. No one's asking any questions. I think everyone's having a great conversation as well. It's really nice to see everyone enjoying the webinar and communicating.
Yeah, no, that's great.
So please, if you do have some questions, pop them in the chat box now and we can answer them. Alternatively, if you do have questions later, you can email Scott or myself or the Knowledge Centre, just to let you know that we have been recording this session, and we will make it available hopefully in the next couple of weeks from our webinars page, and you can go back and listen to anything that you may have missed.
Yeah, no worries, that's good.
While we're waiting for a question, I just thought I'd let everyone know that our next webinar will be on the 9th of May, so we've got a little bit of a break, and it's going to be titled Drug Testing, Issues and Implications for Indigenous Workers. It'll be presented by Professor Ken Pidd and Mr. Alan Triffanoff from the National Centre of Education and Training on Addictions at Flinders University in Adelaide, and that should be another great webinar. So we'll definitely send out more details closer to the date. Looks like we do have a question from Gabrielle. If I want to get an Aboriginal student to be involved in evaluating health or AOD services for Aboriginal and Torres Strait Islander people, can I make contact? I think that's for you, Scott.
Yeah, you could. Yeah, that's right. And you can either just contact me via email, scott@adac.org.au. They can ring me, 08 8351 9031. I do try and get back to people pretty quickly, but you know, sometimes I'm not necessarily in the office. I could be at Ceduna, Port Lincoln, Brisbane, Melbourne. But if they email me, I do check that every day. So, or they could also contact the centre at, like I said, at thegathering.edu.au.
That's great. And could you repeat that phone number for Gabrielle, Scott?
08, yeah, 08 8351 9031.
Oh, 9031. Thank you, Kylie.
And even if we couldn't help them, we probably could point them in the right direction anyway.
Okay, there's a question from Michael. Hi Scott, often researchers say they will build capacity on the community, but what is sustainable capacity?
Well, obviously sustainable capacity is as you might know, is that if for example, you know, what's happened in the past is people will come in, do the research, might do a report back to government or whoever, and then that's about it. What we would hope is that with sustainable capacity, because we've got Aboriginal researchers that are involved in the Centre for Research, that they'll actually be doing the research themselves, and obviously would make sure that, you know, no different than Doug or Benita or Michael Doyle, for example, would be doing, is going back to those communities, letting them know that these were the outcomes of for example, let's say what's successful in a rehab, and then sitting down with those 6 resi rehabs, for example, and sort of saying, okay, this is what the research says. How can we maybe modify or change our services to sort of, you know, meet or match that? And basically, because you're then involved with that Aboriginal researcher yourself, whether it's a service or an individual, you more than likely will be able to sustain those sort of changes. No different than, you know, the 22 Aboriginal community controlled health services that are involved in the treatment study. Then basically by providing them, you know, those 22 services with not just the training, but also, you know, upgrades to their current systems and things like that, it does become sustainable, because the staff will be trained in how to use you know, to do whether it's a brief intervention, whether it's to use the quality management systems that have been modified, and all of that, so that then when you do move on, like whether it's Christy or Professor Kate, when they go back to Sydney, then the people that they've left behind and trained will be able to sustain that sort of service. And if they have problems, then they can contact those people pretty easily. Does that answer your question?
I think so. I think Scott said he agreed that researchers say they would training people to collect data, but it's not capacity building. But we've got some great comments from Kylie as well, based off that question. Was there any last questions before we finish up the webinar today? Please type them in the chat box. While we're waiting for a question, as I mentioned, this is being recorded, so we'll make this available for you very soon. And Scott, you guys might like a copy of it as well. We'll make sure we send you the
that'd be
link so
great.
that you can, send it around and let everyone know about it and they can watch it later. Well, it looks like we've got possibly one or two more questions. I'll just wait for those.
Yep. It's weird, like even though I'm inside, I'm actually sweating.
So Gabrielle's looking forward to downloading the app. That's great. Okay, Syed, Jan has just asked, are there any services in the NT that are currently involved in this program?
There are a couple that are involved in the treatment service program, yes. Obviously, you'd have to ask the Centre for Research Excellence if you wanted to know more about those. But I do know that there's quite a few that are, for example, remote, because Kate and that got lost on their way back from those communities on the way to the Alice Springs Airport because they were driving the wrong direction. So yeah, there are a couple. And Christy,
Doug's made a comment.
Sorry.
No, you go on, Scott.
Yeah, Christy Harrison or Professor Kate Conograve would be able to tell you which communities in the NT are involved, or which Aboriginal community health services are involved.
Excellent. So I think everyone's saying thank you very much, and a little one from Michael. Yeah, so you missed part of the webinar. Sorry about that. Is the app being tried in major cities like Adelaide or Perth, Scott?
It's been tried in the capital city, as well as, like I said before, rural, remote, and an urban. We actually have trialled it in the major capital city as well. We are looking at going into stage 2 of the app, and because when we did stage 1, it was we actively went out and were looking for people that did drink, whether they were social drinkers, whether they were risky drinkers, harmful drinkers. The next phase is that we will pick the same, well, not the same locations, but a rural, a remote, and an urban, i.e. capital city, where we'll just do a prevalence study with the app, so whether people are drinkers, non-drinkers, or whatever. So as many of those sort of people that can participate in a given area will be great.
All right. Well, I think we've had probably a few questions. If anyone has more, please contact Scott or ourselves to continue the conversation. But I'd like to wrap it up there and say thank you very much, Scott, for telling us about the new centre. We've been looking forward to hearing about it ourselves. And yeah, we'll send you the links shortly so that you can watch it again if you need, or make sure you pass it on to other colleagues to watch so that they know about what Scott and all the team are doing. So thank you again, and we're going to sign off. And I think that's it for today, Scott.
Okay, look, thanks everyone for logging in. I hope, like Avina said, that you found it useful or as important as I do, and obviously the team that are involved in bringing the centre to fruition. Anyway, thanks a lot, and happy travels.
Alrighty, catch you later.